Our next topic is the regional updates on shielding, including what to expect in a hospital, returning to work, going to school, and making sure that you are COVID safe. From Scotland, I would like to welcome Dr. Mark Drummond.
Okay, thanks for the invite. Just to give a brief update on the situation with COVID and MPN patients and other patients, in fact. In Scotland, I've been asked to concentrate particularly on the shielding rules and regulations, which are changing in actual fact today, the day of the talk, 1st of August. So in Scotland, we identified shielding patients, MPN and otherwise, via the National Chemotherapy Prescribing System. That's a system that's linked between all the different health boards and can allow us to search for patients on particular treatments. Importantly, we were allowed to manually override this, so we could add patients in who we thought should be shielding. Equally, we could take patients off who we felt shouldn't be shielding, acknowledging that shielding was a big ask for many patients, and it wouldn't be something we'd want to recommend unnecessarily. Broadly speaking, patients in watch and wait, aspirin only, hydroxycarbamide and agrolide, the common drugs for MPNs, were not identified as needing shielding in line with the other colleagues in the UK, i.e. most MPN patients. So the patients we focused on for shielding requirements were patients on ruxolitinib, given potential concerns around immune suppression with that drug, and patients who'd had a previous stem cell transplant, which will apply to a small minority of MPN patients. So very quickly, like other areas of the UK, we had to put in place solutions to allow ongoing patient management. This included remote consultations, mainly via telephone, but increasingly using dedicated video applications. Medicines delivery, all patients in shielding are now getting medicines delivered via post, and community blood testing in COVID safe and distanced community and hospital blood testing hubs. We have greatly limited our physical appointments, like everyone else, excuse me, and our health board in Glasgow, where I work, which is the biggest health board in Scotland, has recommended that 70% of all consultations we should target as for remote consultations, telephone or video. We will see patients physically if there's a change in symptoms down the telephone or other concerns, or they require a change in therapy. So in terms of advice in Scotland going forward, there's the web address, and I suggest you check that because it's continually updated if you want the most up-to-date information. This is up-to-date information as of a few days ago. The government in Scotland has decreed that shielding will be paused on the 1st of August. Note the word paused, indicating that they could reactivate it at fairly short notice at some point in the future if deemed necessary, but it's not being stopped. To facilitate this, realising it's difficult for patients coming out of shielding for a whole lot of reasons, the aim to, how deliverable this will be, but the aim to give individual patient information about risk of condition, give access to local infection rates, and with that information, the aim is for people to make informed choices. And of course, many of the questions we get is the ability to return to work. And as of 1st of August, the government has also stated that patients who have been shielding can return to a COVID-safe workplace as of 1st of August. I would recommend that patients in Scotland sign up to the SMS shielding service. The details are at the web address above. All you have to do is text your CHI number, the Scottish equivalent of the NHS number, and you will be kept up to date and informed directly by text of any changes to this policy. And that's really all I wanted to say. Many thanks.
Thank you, Mark. From Northern Ireland, Professor Mary Francis is going to update us.
COVID in Northern Ireland. We have been extremely fortunate in Northern Ireland that the rate of COVID has been low. Obviously, we have had cases and particular problems with nursing homes as elsewhere, but overall the rate is low, and certainly now it is extremely low, if there at all. From the point of view of our shielding patients, shielding finishes at the end of July, has just happened. So where do we go from here? Well, the clinical services, we are really back up and running in haematology as much as possible. The hospitals are extremely safe. Everything has been looked at. There are one way in, one way out, masks, things have been moved around. So we would want to be really reassuring that patients should come to the hospital, should be seen, but we're also talking to them on the phone, sending medication to them at home if that is more appropriate. We do want to now try to get patients coming back to see us so that we can help as much as possible. I'm not sure about schools, but I hope the schools will be returning at the beginning of September, and certainly people can get back to work as much as possible. However, we all need to keep safe. We all need to practice social distancing, and I think this is likely to be the case for many months to come. I'm always interested in this, listening to people. I tell the story of hearing an opera singer who said about the problem of COVID, and she said, but I can't get the cold, so I've been practicing social distancing for years, going through airports, staying away from people, and I haven't had any infections for years. So this is something that we will all have to do for some time to keep all of us safe. However, and of course we worry that there will be further second waves, or maybe even second ripples, but we want to continue to keep as safe as possible.
And welcome to Claire Woodley, our clinical nurse specialist here at Guy's. She is going to update us on England.
Shielding in England. This information is correct as of the 24th of July. From the 1st of August, the government will pause shielding in England unless the transmission of COVID-19 starts to significantly rise in the community. What does this mean for patients? Well, the National Shielding Service will stop free food parcels and medicines deliveries. Priority online supermarket deliveries will continue if you registered on the government website as being shielded before the 17th of July. The NHS volunteer service will continue, and this service can deliver shopping that you purchase or collect and deliver medicines for you. It is advised that from this time you follow the general guidelines on reducing the possibility of catching the virus. So this is maintaining social distancing, hand hygiene and wearing face coverings. Whilst the government have said that you can return to work if it is a COVID secure environment, they have also said that if it's possible to continue to work from home. During this time, the shielding list will be maintained to allow those at risk to receive rapid advice if there is a change in the shielding advice. We will move on. So, common questions that we have come across. My employer wants me to return to work, but what is a COVID secure environment? This would include being able to social distance from your colleagues, so maintaining a 1 to 2 metre distance from them. The use of appropriate PPE is provided to you. Now, the exact needs will depend on where it is that you're due to work, but please discuss with your employer. Your employer can help with the transition back into work and will be able to provide risk assessments as appropriate, and to also arrange appointments with occupational health if required. Can I attend my hospital appointments? As I'm sure for many hospitals, we at Guy's have developed a number of processes that are in place for patients to safely attend their appointments. The treating team has reviewed which patients they feel are appropriate to attend their appointments, and there are a number of changes that you will see when you visit the hospital. We, for instance, have a one-way system around our hospital. Everybody is provided with masks when they enter the hospital, and there are numerous hand hygiene stations positioned around the hospital. We have also been looking at different ways of working and managing our clinics. So for a lot of patients, you may have experienced remote clinic appointments. These may be through video calls or through telephone calls. And we've also been working very closely with our community colleagues so that blood tests and medication can be delivered to you whilst you're at home. Can I now go out more? Yes, you can. You can go out to buy food, to exercise, places of worship. But in general, it's important to remember the general guidelines for reducing your risk for COVID. Can my children return to school? Currently, the government advice is that they are hoping that all children will return to school in September. If you have concerns about this, it's important to discuss this with your child's school.
From Wales, Professor Claire Harrison is going to update us.
Hello, I'm Claire Harrison. You might be a little bit surprised to hear me talking about shielding in Wales, but believe it or not, I was born in Wales, and unfortunately Steve Napper has taken a well-earned holiday, and so I'm talking about the information that's available regarding shielding in Wales, which was correct as of the 26th of July when I prepared the slide. Infection rates in Wales are generally lower than those in England, but the plan is to pause shielding in Wales from the 16th of August. And at that time, the Chief Medical Officer for Wales will write to everyone who's shielding and advising them what to do next. The advice that's available on the website is as follows. You can go to work as long as the workplace is COVID secure. We have had some discussion about that already. But generally, the advice would be to carry on working from home if you can. You can go outside to buy food with advice of keeping 2 meters or, more easy to remember, 3 steps away wherever possible. If you're receiving a food box, you'll continue to receive them until the 16th of August. And a tricky one and a frequently asked question, children and young people can go back to school or college and university. Thanks.
I think you will all agree that we have received some incredibly useful information as we come into this new normal. And I would like to thank the team of doctors and Claire Woodley who have given us such really helpful advice. Thank you all.